So for the with the type 2 diabetes, we will analyze it as T2DM. Seeing escalating prevalence rate here, innovative preventive strategies are demanded. Genetics and lifestyle factors are paramount in T2D. Our study employed a systematic review and meta-analysis of the to investigate the correlation between different cuisine prevalence and T2D prevalence rate, with insight for the culinary diverse China offering a unique lens on these relationships. Our method here, which is on the bottom left, is our systematic across PubMed, Web of Science, Google Scholar, CNKI, also known as China National Knowledge of Infrastructures, and the study published in 2018 for T2DM and 2023 for protein consumption rates, including all 66,000 participants overall in the total of our studies. We first had, to make this China map, which is in the middle, as you can see here, we first had China map. We then classify the province according to the T2DM prevalence rate, which is here from 20 to 10 scale. We then group the province into 7 regions according to the prevalence rate, color coding them as shown in a central diagram. For these 7 regions, we then classify them into protein consumption in statistical yearbook data from National Bureau of Statistics of China, and classify them into a pie chart, into 7 pie chart here. The result from the color-coded map and the pie chart are explained in a result section, which is on the right side, and a discussion session bar. The result of our finding is that the finding reveals significant inter-regional variability in T2D and prevalence rate. Sources of the protein come from 7 most common cuisine, which are protein 1 and 2, which are 31% and 17% of protein consumption rate, which are dairy products and eggs. Respectively, were associated with positive effect on T2DM prevalence rate. In other words, increased consumption of dairy product and eggs were correlated to lower T2D prevalence rate in northwest regions, and which are overall in average consumption, we can consider it as negatively balanced. On the other hand, protein 3 to 7, which is pork, beef, mutton, poultry, and seafood, did not represent a positive effect on T2D prevalence rate. More specifically on protein 4, 6, and 7, which are beef, poultry, and seafood, show negatively low negative effect on T2D prevalence rate. For the Northeast region, Northeast has a higher T2D prevalence rate than the Southwest and Southeast, despite the Southwest and Southeast region upper here has a 41 to 34% respectively to Northeast 29%. This shows that cooking and seasoning method of protein sources, such as processing meat, local climate, may have a greater impact on T2D prevalence rate, even more than a consumption rate value. For more research being needed, this meta-analysis is performed on this research on its significance in terms of how many individuals are affected by T2DM. Further research is needed for all protein food research, especially for poultry, for example, which more research are required. From inside discussion, our research are able to highlight need for tailored public health, recommendation to advise growing burden of T2DM, and recommended cuisine to consume. However, the limitation is that we did not account for physical lifestyle such as socio-economic status, and also which may influence T2DM prevalence rate as well. But further research and extension from our future scientists are recommended for further credibility. The review does not account for carbohydrate and fat, which is seen in this table here. Is that the reason why we choose protein but not carbs and fat is that, firstly, popular culture making concepts like glycemic index, blood glucose level, insulin sensitivity, and dietary choice in terms of macronutrients intake more significance. And protein are likely to perceive to be more superior macronutrients compared to carbs for T2D management. However, popular culture may not account for protein sources may be processed as well. And so to test the merit of our protein, pro-T2D food, protein will focus upon our research as well. Secondly, different regions have their own staple carbohydrate food. For example, southern people like rice more, northern people like noodles more. This is associated with their own cultural practice, but may vary in its protein types. And so the potential for recommendation will be made this way. Third, fat is more about seasoning. What matters is how much edible oil people consume. And as you can see in the column chart here on the bottom left, the way other people consuming edible oil in 7 regions doesn't make a difference. Besides, we mentioned that processed food just now. There is an overlap between protein and fat when it comes to processed food when the people cook. So thank you. Yeah.
Okay, such an impressive work. So do you have any comments or any questions?
Thank you for your presentation. Could you please explain more about your methodology, please?
Yep. My methodology is that I use the PubMed Google Scholar CNKI because this is a lot of Chinese data. So finding it on Google Scholar would not be able to access a lot of Chinese. So we use so our teammate are actually Chinese. So we actually use the Chinese research paper and we translate it into English across 66,000 patients, 66,000 people who have type 2 diabetes. And we use the data from 2018 for T2DM. And we also use the 2022 for the consumption rate of the protein. We did not mention type 1 diabetes because it's mostly genetics. And as we all did a research here, I find that it's only 1.5% of the people who have type 1 diabetes in China overall. Yeah.
And what is your search term when you do the search in the search engine? Search terms.
Yes, we do T2DM, so type 2 diabetes mellitus, and we do the dietary cuisine, and also we do the staple food, the carbohydrate that they consume, the fats, and also the rates and the protein. And we do the prevalence rate, so it gives us the number and also the statistic for each number. That's why we are able to create a pie chart, and then we create a ratio, and then we calculate into the percentage for each region, 7 region.
Actually, it's quite interesting. So I would like to see more about the articles that you include in your search and your review that will give us the idea where are they come from or what kind of study they did, something like that. To see that will show us about what the detail that study conducted. It will give the audience more understandable about the idea that you already conduct. But it's quite interesting about this topic. Thank you.
Yeah, thank you.